Good afternoon. This is Joanne Spetz at the University of California, San Francisco, and I'm here with Judy Berg and Teri Hollingsworth for today's webinar. Thank you for being here today. If you have any questions, we will be taking questions in the chat area for questions there, and we will be doing question and answer at the end of the presentation. Today's presenters are myself. I'm Joanne Spetz. I'm at UCSF at the Institute for Health Policy Studies. Teri Hollingsworth, who's Vice President of Human Resources Services at the Hospital Association of Southern California, which many of us call HASC. And Judy Berg, who's the Chief Executive Officer of HealthImpact, which was formerly known as the California Institute for Nursing and Healthcare. So our goals today are to learn about how chief nursing officers perceive the current labor market in California for registered nurses, track latest hospital vacancy and turnover data, and understand how recently graduated nurses are faring. We really want to answer the question, is there an RN shortage in California, and or will there be one in the future if there isn't one now? We also want to talk about the next steps to ensure that we have an adequate nurse supply in California. And while I'll be the first to say that our research for this presentation is very California focused, we're hearing many of the similar stories that we will be talking about today in other states and in other parts of the United States. The work presented today is supported by a number of different funders. The original funding for this project came from the Betty Irene Moore Nursing Initiative, which is part of the Gordon and Betty Moore Foundation. So we are continuing that work as was initially started by them. Funding also has come from the Kaiser Permanente of Northern California and the California Board of Registered Nursing. And we'd like to acknowledge FutureSense LLC for their work in supporting HASC in their surveys of hospital leadership, as well as UCSF staff and interns, Leela Chu, Lena Liebeteek, Timothy Bates, and Amy Shinoki, who have been helping us with this project. So what is going on in our nursing labor market? We are still seeing newspaper stories about graduates who are unemployed. These really peaked a few years ago, that we were hearing about a lot of new graduates in around 2009 and 2010 who couldn't get jobs in nursing. We are still seeing some of those reports now, but maybe not as frequently as we did 5 years ago. We also are hearing that hospitals are having a hard time filling key nursing positions. And there are some anecdotes about hospitals using more contract nurses, and maybe a little bit of systematic data beginning to support that idea. So we're wondering what is coming next with our nursing labor market. Some of these different factors, like hospital reporting that they can't fill key positions, are often associated with the emergence of a big nursing shortage, but at the same time that usually doesn't come with stories of new graduates who are unemployed. So it's a little bit of a confusing set of signals, and we're trying to really understand what's happening for workforce planning. So we'll begin with how chief nursing officers are perceiving the current RN labor market. This is based on a survey of chief nursing officers. We've now done 8 of these surveys. It's a web-based survey with the option to return it by paper or via fax or email, and we do telephone calls to chief nursing officers to encourage their participation. Now, I'll be the first to say, for reasons not entirely clear to us, this year our response rate was quite a bit lower than it was for the fall 2015 survey. So we have 114 facilities represented in the data. But for those of you who are California Chief Nursing Officers, if you feel like these data are not telling the full story, please make sure you complete the survey when you get it next fall, because the data are only as good as what you tell us. One of the key questions in the survey is of basically a quick 1 to 5 scale of how you perceive the overall labor market as a chief nursing officer. And the options range from demand is much less than the supply available, which is the dark blue bars, and that would indicate a surplus, through there being high demand and it's difficult to fill open positions, and those would be the orange portions on this chart. So as you can see, when we were in the deepest parts of the recession in California, most hospitals were reporting that demand was less than supply, and or there was a balanced labor market. And as the economy was recovered, especially as you get into 2014 and onward, you're seeing that a majority of hospitals are reporting that they are having at least some difficulty filling open positions. In fact, by 2016, it was essentially 90% of hospitals were saying that they were having difficulty filling open positions. So this is a remarkable recovery of the labor market from the depths of the recession. It also is indicating that there's overall very high demand for nurses in California. We also are seeing some regional differences across the state, and I want to be cautious about how to interpret year-to-year changes because different hospitals are responding to the survey each year. So these are not necessarily the exact same hospitals year to year, and therefore fluctuations in the average scores from 3.9 to 4.2 may not be meaningful. This is the same data as you saw in the previous chart, where a surplus was scored as a 1.0, and then that highest category of high demand, difficult to fill open positions is scored as a 5.0. And so an average of 3 would mean a balanced labor market. An average of 4 or 5 would indicate a shortage, and an average below 3 would indicate a surplus. So as you can see, the average scores that chief nursing officers were reporting in their labor markets tended to be in the surplus range through about 2013 or so, and then we started moving more into a balanced labor market around 2012, 2013, and we've been moving into a shortage in most of the state as we've gotten into past 2014. The degree of severity varies across regions of the state. The San Diego data, I think we need to be cautious of. We had many fewer respondents this year than last year, but clearly the people that did respond feel like the shortage in San Diego is getting very severe. Central California has been one region with a more consistent set of reports towards severe shortage than other parts of the state. At this point, though, all of the state is facing challenges in recruiting nurses. We asked specifically about the challenge in recruiting nurses with experience, and this is where we really see a movement towards reports of shortage. In fact, as early as 2013, when we first started asking this specific question, you can see that the average score across almost every region of California has been that there is a shortage of experienced RNs. In contrast, when you ask about new graduate RNs, over that same time period, there has generally been a tendency to report a surplus of new graduates. Now that is changing. Over the years, you can see that the market has moved in almost every region towards more of a balanced labor market. And that is certainly true now in Central California, where the chief nursing officers that responded indicated that they felt like new graduate demand and supply were well balanced. Most of the rest of the state is indicating some surplus of new graduates, but not as severe a surplus as in 2013. We separated the data by urban and rural regions, and as would be consistent, I think, with every national analysis that's ever been done, rural hospitals face more challenges in recruiting nurses than do urban hospitals. We looked at a number of different kinds of nursing positions in the most recent survey to get a sense about how different kinds of RN roles are facing in the labor market. The most difficult recruiting situations were reported on average for experienced staff nurse positions. And then other registered nurse positions also were indicated to be in fairly short supply. Those other nurse positions include things like case management, utilization review, and other roles that don't involve direct patient care. Clinical nurse specialists are also a fairly significant level of shortage, as are nurse practitioners. On the other end of the scale, there's a sense of some degree of surplus of aides, LVNs, and new RN graduates. We asked CNOs about changes in employment in the last year, and you can see again signs of recovery in the labor market. 2/3 of employers indicated that they had increased their hiring of new RN graduates over the past year, and only 6% or so said that they had decreased employment. You can see also that there has been increased employment for every of the categories that we asked about, ranging from CNSs to LVNs to unlicensed aides and assistants, as well as nurse practitioners, where 60% of respondents said they'd increased NP hiring over the past year. Employers were also asked about their hiring requirements and preferences, and we saw some shift over this in the survey respondents. And again, we have to be a little bit cautious in interpreting this because it's not exactly the same hospitals responding each year. But there does seem to be a greater share of hospitals saying that they have no specific requirements for hiring right now, and a bit of a drop compared to 2015 and 2014 in the share that indicate that they have a minimum experience requirement. So this is consistent with the idea that hospitals are getting to be more willing to hire new graduate RNs. We asked about plans with respect to bachelor's educated nurses, and about 2/3 of hospitals say they plan to increase the share with a baccalaureate degree. This is a little lower than in some of the previous years, but again, I'd be cautious in saying that this is any significant change. About 10% require that hired RNs have a bachelor's degree within a certain amount of time if they don't have a bachelor's when they are hired. More than half require a bachelor's for promotion beyond staff nurse. So the preference for bachelor's educated nurses has been continuing even as the labor market has gotten tighter. We even are seeing about 40% of hospitals report that they differentiate RN salary by the education degree. Hospitals' CNOs were asked about the challenges that they face in increasing the share of nurses with a bachelor's degree. The most common barriers were a lack of interest among incumbent RNs, which isn't surprising. If you are an older, experienced nurse and have great experience and skills to fulfill your current job, pursuing an additional degree may not be of great interest or value to you. But other factors are more of a concern and more directly managed by the local community and by the hospital. Lack of tuition reimbursement funds, lack of funds to provide financial incentives to nurses to pursue additional education. Scheduling and staffing barriers came up as a more important issue, and this really wasn't much of an issue in the last survey. I'll talk in a little bit about why I think this is cropping up now as an issue. And then a lack of bachelor's educated nurses in the community and programs to educate them in the community. CNOs were asked about hiring expectations for the next year, and in 2016-2017, about 3/5 indicate they plan to do more hiring over the next year than in the prior year. You can see in general that CNOs have indicated a bump up in hiring that really came with the implementation of the Affordable Care Act in California, and that seems to be persistent. We also asked about expected hiring in specific care settings of hospitals over the next year. And inpatient care is where there is the greatest expectation of increased hiring over the next year. But again, there's increased hiring anticipated across all the areas of the hospital. I will note that the share of hospitals indicated more hiring is expected for ambulatory care, home health, and long-term care dropped off somewhat relative to the prior year. And I speculate that this is related to uncertainty about the Affordable Care Act and uncertainty about how rapidly value-based payment mechanisms are going to continue to expand through the health system. CNOs were asked to estimate the percentage of new graduates that were among their new hires, and these data are also reported to HASC in their vacancy and turnover survey. And it remains that about 1/3 of full-time new hires have been new graduates. And so that's been fairly consistent, and essentially as hiring is increasing, the share of new graduates in that hiring is staying stable and therefore also increasing. The number is increasing. Employers were asked about their offerings of residency programs, and the questions specifically focus on residency programs for non-employee new graduates, as distinct from onboarding programs for people who have been hired. About 1/5 of hospitals say that they have a residency program for nurses who are not guaranteed to be hired, and that's a similar rate as the last survey. Nearly 2/3 indicate that this is a paid program, and about 77% indicated that at least 3/4 of the residency completers end up getting hired by them in the last year. So while these might not be programs to onboard newly hired people, they seem to be a facilitator of hiring. Nearly a quarter said that they hired less than 25% of their residency completers. So it's worth noting that some of these programs are entirely about skills development and not focused on being a hiring stream for hospitals. The areas in which residency programs are being offered has changed a little bit. These are ordered from the least common to the most common as of the fall 2015 survey, so that you can see changes in the predominance of certain areas of offering. So if you start at the bottom, in 2015, medical surgical was the most common area for for these residency programs to be focused. Now, actually, emergency and critical care have surpassed medical surgical as being the most common areas that residency programs are focusing. You can also see that psychiatry has increased in importance as an area for these residency programs. These areas all reflect some of the specific areas that CNOs are telling us that they face the greatest shortages: emergency, critical care, operating rooms, obstetrics and newborn, and to some extent pediatrics and neonatal. And we know that the need for psychiatrically prepared RNs is growing statewide due to increasing parity in mental health coverage and the ongoing issues with substance use disorders. CNOs were asked about their hiring expectations for new graduates, and as in the 2015 survey, nearly half say that they expect to hire more new graduates next year than they did in the prior year. For those that said they expected to increase their hiring of new graduates, they indicated a number of reasons. As in prior years of this survey, a lack of available experienced RNs and expected retirements of incumbent RNs are common reasons for expecting to increase new graduate hiring. But two new reasons cropped up in the survey this year. A number of CNOs indicated they will hire more new graduates over the next year because they've developed relationships with RN education programs to more deliberately prepare their new graduates for needed roles, and/or they've also developed mentoring programs for new graduates. In other words, chief nursing officers seem to be taking proactive steps, sometimes in collaboration with local educational programs, to ensure that new graduates can help fulfill the needs that they have, and thereby make it easier and more justifiable to hire new graduates into roles that might be vacated by a highly experienced nurse. So I'm going to turn this over now to Teri Hollingsworth to talk about some of the latest vacancy and turnover data that the surveys conducted by HASC have revealed.
Great, thank you so much, Joanne. Good morning or good afternoon to everyone. I'm the Vice President of Human Resources Services here with the Hospital Association of Southern California. And I'll begin providing you with a little background information before we get into the data. For those who are not familiar with the Hospital Association, we're a regional trade association that represents the interests and serves the political and economic needs of over 180 hospitals across the Southern California region. The information that I'll be presenting to you today comes from the third quarter of 2016 Healthcare Workforce Report, and it is reported by the Human Resources departments within hospitals. The Healthcare Workforce Survey is a collaborative effort of HASC, UCSF, the HealthImpact, CHA, and FutureSense, and it's designed to collect workforce data from hospitals across the state, including turnover, vacancy, new hire data. We collect it on a quarterly basis from hospitals, and the final report is provided to participating hospitals to help them make informed decisions. So in the fall of 2016, 232 hospitals across the state participated in the survey, and I'll be presenting to you highlights from that report. So in this first slide, you'll see information regarding hiring trends. We asked hospitals to report employees hired during the third quarter of 2016. This slide examines hiring trends of specific nurse categories from the fall of 2013 through 16. The hire rates for the nurse categories shown have been pretty consistent over the years, with the exception of the aides and unlicensed nursing categories. Hiring rates for RNs who work in the emergency department and the case management departments, we're seeing an increase in hiring rates in those departments. And we're seeing a large increase in LVNs. What we're hearing from our hospitals is that LVNs are not necessarily being hired for the acute care part of the hospital, but more so for the affiliate non-acute departments such as home health, hospice, long-term care. For definition purposes, the registered nurse other category shown on the report on the slide represents those nurses who do not provide direct patient care, and they work in other capacities. We're also seeing that hiring rates for new graduates is up, reported at 30% by HR professionals. Next slide. In 2016, we're seeing a slight decrease in RN vacancies from last year's 6.9, but still higher than 2010 and 2015. As we know, some of the contributing factors, we're seeing the aging of RNs rapidly year over year. Facilities are losing experienced RNs, are not able to hire or rehire new ones to take their place as the supply of experienced RNs is shrinking. When we look at the specialty areas, the highest vacancy rates are for ER and case management and NICU. And we're also seeing that vacancy rates for new graduates is reported at 6.4%. Next slide, please. In 2016, turnover is up for the other RN, LVN, and AIDS categories. This might suggest that RNs are switching employers in a hot labor market for experienced RNs. We're also seeing higher turnover rates for RNs who work in the ED and critical care units. Next slide, please. We're not seeing much change here when it comes to per diem, contract, and agency labor. We have received reports from our hospitals that several of them expressed concern about the rising rates for travelers and the shortage of specialty nurses needed. Hospitals are implementing strategies to deal with this issue, such as creating their own training programs, implementing retention strategies, and creating flex and float pools. Next slide. Back to you, Joanne.
Well, thank you, Teri. I'm going to hand it right over to Judy Berg to talk about the work that her organization has done in learning how new graduate nurses are faring in the labor market. So, Judy, it's over to you.
Thank you, Joanne. Next slide, please.
Okay, and pardon me, for some reason my computer is being a little sticky about forwarding some slides. So if I get stuck, please forgive me.
Thank you. I'm Judy Berg, and I'm the CEO of HealthImpact. HealthImpact is California's nationally recognized nursing workforce center. And up until about a year and a half ago, we were known as the California Institute for Nursing and Healthcare. So some of you may still be unfamiliar with our new name. We are the lead of the study team for this survey around new graduate nurse employment. And our partners in this survey are the California Board of Registered Nursing, the Association of California Nurse Leaders, and the California Student Nurses Association. And we are grateful and have appreciated very much the funding from Kaiser Permanente, Northern California, for this survey over the past 7 years. Next slide, please. This survey is a random survey of 50% of the newly licensed registered nurses in California between 2015, September 2015 and August 2016. So it's over a 12-month period of time. And you can see that this year's survey had a much higher response rate, for which we were pretty excited, than we had had in years before. And we believe it is because we were able to solicit responses to the survey through email rather than through a mailed letter. And people were able to click on the URL and get right into the survey, and it certainly had an impact on response rates. So we're feeling good about the results of the survey. Next survey, please. Next slide, please. This is the profile of respondents to the survey. You'll note that 47.7% of the respondents came out of the ADN programs, and you can see the balance coming out of BSN and MSN programs. And that actually very closely reflects graduation rates from those 3 program types in California as well. Next slide. This is the geographic distribution of the respondents to the survey, and again, very closely reflects graduations regionally across the state. So again, we had a very, very nice representation in the survey reflective of where new graduates were coming from in the state. Next slide, please. This slide shows that there has been tremendous improvement in new graduate hiring over the course of this survey being done. Back in the early years of the survey being done, 2010, 2011, 2012, the recession was significantly in force in California, and that was reflected in new graduate hiring rates as experienced nurses tended to remain in their positions. Vacancy rates fell. There was far less opportunity for new graduates in the employment arena. We've seen that change as the recession has abated in California. We've seen the hiring rates of new graduates improve. And there was a 9% improvement between 2014 and 2015. And now we've seen almost an 11% increase between 2015 and 2016. So fully 85% of new graduates are finding employment within that first year of becoming licensed. Next slide, please. There are some regional differences, and that is reflected in this slide. The regional differences are different, particularly in a couple of areas from 2015 to 2016. We're seeing the most pronounced increase in hiring in the northern Sacramento Valley, which is the far light gray bar. There actually was a 28% increase in hiring in that particular region. We've also seen significant increases in the Central Coast, which is the light blue bar right next to the gray bar on the far right. And we continue to see strong hiring in the Central Valley of California. 95% of their graduates are finding employment. There is also significant increases in employment in the other areas of the state, including Orange, Inland Empire, et cetera. But we can see that there's been improvements in all areas, but there are some regional differences. Next slide, please. We also see that employment rates vary by education, and this shows that trending over the last several years. While all new graduates have seen improvements in their hiring rates, those improvements have been greatest in newly licensed nurses with a baccalaureate degree. We see the lower hiring rates for nurses with the entry-level masters, but we are surmising that those lower rates might be purposeful because the nurses are becoming licensed while they're still in their entry-level master's programs, and they may be choosing to finish their educational programs rather than look for employment. Next slide, please. This slide shows the correlation, if you will, between hospital employers either preferring or requiring a baccalaureate degree upon hiring. Joanne talked about this a little bit earlier. And then in our survey, we ask the new graduates, newly licensed nurses, who did not find a job, how many of them weren't able to find a job because they didn't have a baccalaureate degree. And you can see that it does factor in, and that 39.5% of newly licensed nurses indicated the reason for not having a job offer was because they did not have that baccalaureate degree. And at the same time, 85% of hospitals, in fact, prefer or so there's a growing interest in baccalaureate education on the employer side, and it does impact those new graduates, newly licensed nurses who do not have that baccalaureate degree. Next slide, please. We also look at where new graduates are working, and as is reflected in this slide, it is overwhelmingly in hospital settings. So slightly over 2/3 of new graduates find their first employment in hospital acute care inpatient areas. Another 15% are working in hospital outpatient areas. So over 80%, almost 83% of new graduates are working in hospitals when they are newly licensed. Next slide, please. We also ask newly licensed nurses if they participate in a transition to practice or residency program when they are hired into their first positions. And as you can see here, slightly less than half are participating in a residency program. Now, most of those residency programs are employer provided, but a small percentage are School of Nursing based in partnership with a clinical setting. So this is not reflecting the recommendation that was recently included in the nursing education plan for California, which indicated that all new graduates should be able to participate in a transition to practice program. We're falling quite a bit short of that, with this data showing that we're at 47.6%. Next slide, please. This slide reflects the types of residency programs, or the length of residency programs, if you will, that newly licensed nurses have participated in. There's kind of a little clustering blip around 2 to 4 months, and then there's another blip at 12 months. We know that the evidence around these residency programs supports them being 12 months in length. So slightly over 20% of the residency programs out there are in fact 12-month programs. Next slide. And then we ask for the nurses who didn't find a position, that 15% of licensed nurses who did not find a position. What were the reasons for not being hired? And of course, the number one reason is no experience. It's a little bit of a catch-22 there, we all know. The second most commonly chosen reason was the fact of not having a BSN degree, or that it was preferred and there were other applicants with a BSN degree. And the third reason was that there were no positions available to be hired into. So that may very well reflect the need for experience in certain positions, rather than the fact that the position is not available, period, at all. Next slide. And back to you, Joanne.
All right, thank you, Judy. It really was great to see the data this year showing a much higher share of new graduates able to find work. So being able to track that has been wonderful, because we've all been worried about these new graduates who can't find jobs, at the same time that employers are saying that they want more experienced nurses. Those new graduates will never get experienced if nobody hires them. So we want to look at the bigger picture question of whether there is a nursing shortage in California. We do have some indicators that one could be emerging. And so I will put this into some context. We've talked about their current anticipated job growth, and that there also is a sense of inpatient care growth and census and higher acuity and growth in demand for ambulatory care services. And certainly the change in the federal administration has caused some uncertainty about what might happen with respect to insurance coverage and the Affordable Care Act. But I think in California, we're generally anticipating that there will continue to be a great need for both ambulatory and inpatient care services that nurses provide. We also know that there are reported shortages of experienced nurses, especially in specific settings such as the OR, labor and delivery, emergency departments, and intensive care. Some hospitals are reporting a difficulty recruiting nurses into case management as well, which is a growing area for work for registered nurses. Finally, the expected retirements of registered nurses. People have been saying for 20 years that when baby boomer nurses hit retirement age, it's going to be a large number of nurses leaving the labor force, and we are finally getting to the point where we're seeing that happen. So there are a lot of incumbent nurses who are going to retire and take their tremendous experience and expertise with them. So we as a nation and as a state need to be prepared for that. So California has done a very good job of being prepared for that, to be honest. When the last nursing shortage was at its worst in the kind of 2003 period of time, we were graduating only a little over 6,100 nurses per year in the state and relying very heavily on recruitment of nurses internationally and from other states to fill our needs. By the 2009-2010 academic year, we were graduating more than 11,000 nurses per year. And that is based on some analyses that we had done around 2006, pretty much exactly the number of nurses we need to graduate to have a balanced labor market in this state and fulfill the gap that will be created as baby boomer nurses retire. Even through the recession, when our California educational institutions have faced significant budget challenges, they have maintained nursing graduations at around 10 to 11,000 over that full time period. So we are very grateful to the educators who have continued to dedicate resources to ensuring an adequate supply of new graduates. What that means when you look at California's state-specific forecasts of supply and demand, I know this chart has a lot going on it, but I'll walk you through it. The solid dark blue line that is actually almost completely hidden through some of this chart is the best supply forecast, and the dashed dark blue line is what we would think of as the worst case scenario, where if we have a decline in the number of new graduates and also we have a decline in employment rates of current nurses. So we like that best supply forecast, but we always feel like we want to put a worst case scenario out there for everybody to see. The solid turquoise line that essentially overlaps that dark blue line is a forecast of future need for nurses based on extrapolating off of inpatient hospital utilization patterns and the share of nurses that have traditionally worked in hospital settings versus other settings. As you can see, that line is pretty steeply sloped, and that's because we know as our population ages, people are going to have increasing care needs. And so that slope line reflects that increasing care need of an older population. Those lines are basically on top of each other, which means that over the long haul, we are looking at supplying about the right number of nurses for the demand available. We also have that compared to if we were to try to attain the goal of having a full-time equivalent employed nurse to population ratio at the national 25th percentile, as opposed to California's historic position usually being in the bottom 10, we are on target to actually even hit that benchmark around 2031. We may even possibly be able to hit the national average not too long after 2035. Overall, this suggests that our supply of about 11,000 new graduates a year is keeping our labor market on target for a long-term balanced situation, which is exactly what we want. If we have too much of a surplus, new graduates can't find jobs. And if we have a shortage, of course, we end up with big wage increases that are very expensive to our healthcare system. We end up with patient care needs not being met. And we end up with just a crisis mode that we know that we can avoid and that we are avoiding. We will have new updated forecasts available within the month based on the 2016 survey of registered nurses and the newest data available from the Board of Registered Nursing. So stay tuned for that. So we're in great shape, we think, for ensuring an adequate nurse supply. But what we have to point out is that the forecasts that I presented are statewide. They don't reflect issues that might exist around the skills of our nurses or on the specific regional differences that Judy pointed out regarding hiring of new graduates and that we see in the Chief Nursing Officer reports. So the concerns that we have for workforce policy is what kind of education changes might we need to ensure that our new RN graduates have the right skills in a rapidly changing healthcare system? As care models are evolving and shifting, where and how healthcare is being delivered, how does that affect what kind of nursing education is needed? Ideally, we will be seeing more emphasis on ambulatory care and preventive services and less of a crisis mode of hospitalization and emergency department visits. So what kinds of skills and knowledge do nurses need in order to fill the best roles possible in these kinds of new healthcare systems? How do we foster opportunities for nurses to gain the on-the-job skills that they need and to pursue additional education? And now that we have the stabilization of the number of new graduates in the state at about the right level, how do we make sure that they go to the right places where the biggest shortage exists and that the right skills are in those places? Finally, we know that employers are preferring to hire nurses with a bachelor's degree or higher degree. How do we increase capacity in RN to BSN education programs so that associate degree graduates can access that bachelor's degree education to enhance their skills and maintain the quality of that education? So I'm going to turn it over to Judy to talk about some potential solutions, and then Teri also has some information to share with us as well.
Mm-hmm.
Thank you, Joanne. So part of the solution, a big part of the solution resides in academic practice partnerships, and it's just critical that employers partner with schools of nursing, that there's an investment in new graduate hiring on the part of employers. It is less expensive than a shortage. We've certainly seen that in the past. And as some of the items affected, the slide reflects here, recruitment costs, costs of patient care lapses, costs of rapid wage increase can all be mitigated when there's investment in new graduate hiring. It also is the pipeline for experienced nurses of the future. And we need to remember that. We need to remember that you don't get experienced nurses without hiring new graduates at some point. And one of the issues around the shortages that are being experienced right now in specialty areas is that we slowed down hiring of new graduates over the last many years. So there isn't that pipeline, robust pipeline having been built up over the years, moving experienced nurses into those specialty areas. So we really need to pay attention to that. Employers need to invest in transition to practice and residency programs. Every single new graduate needs to have experience monitored, mentored, and structured through a transition to practice or a residency program. We also need to invest in transition in practice programs so that those experienced nurses can move from one specialty to another in a very structured and purposeful way that is really reflective of the levels of quality that are now needed in our clinical settings. Employers can also provide clinical faculty for their schools of nursing. Nobody knows patient care in the clinical setting like the people who are working there. and to partner with the academic centered academic programs by providing clinical faculty is a really important way to not only keep quality and up in the clinical setting, but also support the school and the educational program. And then, as Joanne mentioned, this issue around flexible scheduling for RNs pursuing advanced degrees, particularly for RNs who are pursuing their baccalaureate and master's degrees, to have an employer who is willing to work with them around their academic schedule it really pays off in the long run and makes a huge difference in the success of these registered nurses pursuing advanced degrees. Next slide, please.
Joanne, I'll add to that before you move on. What we're also hearing from the hospital association's perspective is that hospitals are looking for some creative retention strategies of the existing experienced nurses. And so we're hearing a lot of strategies being implemented. We're hoping to be able to capture some of them and highlight them so that other hospitals can learn from hospitals that have successfully implemented retention strategies. I also wanted to underscore the fact that we are going around the Southern California region now and assessing the workforce issues that many of our hospitals are experiencing. And some of these solutions that are outlined on this slide, these are what we are encouraging our hospitals to do in terms of partnering with the schools. We do know that the return on investment is incredible when you do that. And so we're definitely highly encouraging our hospitals to begin partnering, if they're not actively partnering with their schools, to spend some time and investment in that area.
Thank you, Teri. That's excellent reinforcement, I think, for a really strong and robust partnership.
Yes.
Next
Indeed.
slide, please. Educators. I mean, the partnership needs two strong partners, and so our academic partners, our schools of nursing, also have much that they can contribute, and we're starting to see electives, specialty electives, being offered in clinical areas of shortage, and these are really innovative programs that are allowing students, while they're still in their pre-licensure programs, to gain additional clinical exposure in specialty areas, particularly those with a shortage. We really support this concept of streamlined academic progression, and we're seeing increased partnerships between community colleges and baccalaureate and master's degree granting organizations so that students and newly licensed nurses can just seamlessly continue on with their education. We're seeing and really also encourage partnerships with schools of nursing and clinical settings outside of acute care. We're actually seeing evidence of this, but there are many settings outside of hospitals where nursing care very appropriately happens, and they're increasingly being used as clinical settings, which is great to see. And then we're also beginning to see employers more frequently being included in conversations in schools of nursing around clinical content. The practice setting is changing so rapidly right now, not just the regulatory changes that impact practice, but the evidence that is beginning to really drive changes in practice, and technology that is a huge driver of practice is really creating so much change in clinical settings, not just in hospitals, but all along the continuum of care. And it is becoming critically important to make sure that employers, the experts in those clinical settings, are involved with their academic partners around how to prepare nurses for working in a very rapidly changing clinical practice setting.
Thanks,
Joanne, you want to take this one?
Sure. Well, you know, I think hopefully we've hammered down enough over the years and today how important it is to maintain our education capacity. In addition for it being important for educators to work really closely with employers to innovate their programs and ensure that nurses have the skills that we need, we also just need to make sure we're graduating about 11,000 nurses a year. And that means that we should not let enrollments drop. And we need to think about factors that support students and support the diversity of our nursing workforce, such as scholarship programs, including the Health Professions Education Foundation programs that are operated by our Office of Statewide Health Planning and Development. And we need to think about exploring non-traditional clinical placement settings and the best use of simulation in order to help streamline education and keep it within our budgets, but not to have any reductions in the services and the educational opportunities available. So this is an area where really policymakers can continue to make the financial support that our system needs and to help employers and educators do the good work that they're doing to try to make sure that new graduates are able to step into the roles that we need for the future. We will be publishing this webinar and the slide deck for it, as well as the recording that's being made today on our website for this project. It's rnworkforce.ucsf.edu. This is a screenshot from yesterday, so every once in a while the design changes a little bit, but this is pretty much it. You'll see up at the top that there are tabs for demand data, supply data, education data, publications, and resources. The demand data includes the survey report that will be published in about a week from the presentation today of Chief Nursing Officers. We try to get links onto that also and onto the publications page to the survey work that Judy presented. And we create for all of these different tabs in this different kinds of interactive charts. So we are presently updating the chart for the 2016 data, but soon, probably about the same time the report is published, there will be an interactive set of charts that you can use to look at demand and supply for different regions of the state as well as the statewide data. So if you're looking for a data point because you're writing a grant and you need to talk about whether demand for nurses is rising or falling in your region, this will be a really quick place for you to get those data. Similarly, looking at the web page, the supply data is information from the Board of Registered Nursing's biennial surveys of registered nurses. The 2016 preliminary data are going to be presented to the Board of Registered Nursing in early May, and we anticipate that the report will be published about a month after that. And then finally, the education data includes links to the annual school reports that the Board of Registered Nursing publishes. Those are surveys of every nursing education program that does pre-licensure education in the state of California. And so that's where we have been able to track information about the number of new graduates per year, the number of new enrollments, attrition rates, diversity of students, and other factors. So please do check it out. We try to keep it up to date. And we are happy to add resources or publications that are particularly pertinent to the mission of this work. Finally, we encourage you to go to the Board of Registered Nursing website. You need to go to the Forms and Publications link, which is over on the right under the Quick Hits tab. And there, then you will get the choice to go to Reports, and you will see all the different reports directly that the Board of Registered Nursing sponsors. So we have a little bit of time to take questions. Please type your questions in the chat boxes, and I will be tracking those boxes and directing questions to Judy or Teri if appropriate, or answering them myself. And the only one that I see is whether these PowerPoints will be available. Yes, indeed, they will be posted on the website. Usually it takes us, we probably will be putting them up at about the same time as the webinar recording, because we're going to want to cross-check one more time for all the data accuracy, and the PowerPoints and the final report will probably be posted at about the same time. All of those who registered for this webinar, whether or not they were able to attend today, will get an email notifying them when the posting is up.
Joanne, there are more questions.
Oh, I cannot see them.
You can't see them?
No, so but please go ahead and read them in whatever order you want.
Okay. Let's see. Still stories of silver tsunami about to really occur, and LVN not being employed in acute care, only long-term care. I guess
right.
that was...
Well, we're seeing, we did a study, and this is very consistent with what Teri discussed. We did a national study looking at trends in LVN employment and LPN employment nationally. And what we are seeing across the country is over the past 20 years, there has been a decline in the share of LVNs employed in acute care settings. Where the job growth has been for them is long-term care and especially home health care. I think a lot of home health agencies are learning that LVNs are in a really good position, partly because so many have nursing home experience, to provide services in the home for people. They can administer medications, they have clinical knowledge that can be very valuable when assessing a homebound individual, and thus there is a really nice set of job opportunities there. But we are seeing fewer of them in acute care, and the jobs that are attached to acute care are typically in the non-acute divisions of hospitals.
That's correct.
Okay, there's one. Please comment on the impact of RN from other countries, apparently mostly from the Philippines, on the California RN labor market.
Oh, that's another great question. Of course, you know, we've had in California a very long tradition of Filipino nurses coming to work here. And I would say the peak of that immigration we probably saw during the last shortage, during the period from about 2000 to 2006 or so. We are not finding many hospitals reporting engagement in any international recruitment right now, but there is a recognition across the state of the importance and the experience that Filipino nurses bring to our workforce. I also have a colleague who is doing some research and has found that many nursing home directors or chief nurses within the nursing home setting are also of Filipino heritage, which was very interesting to me. She's an expert in long-term care, and so I found that work to be very interesting about how many Filipino nurses are working in that field. Now, I would anticipate that international nurse recruitment will continue to be fairly low as long as California is graduating about 11,000 nurses a year. But if for some reason our education capacity in nursing starts dropping tremendously, I could easily see hospitals returning to the international recruitment because it's been such an important stream for us in the past.
I'm amazed that an increase in RN pay due to RN shortages is seen as a problem. Seems to me that RN salary are the least likely reason why U.S. medical care is absurdly overexpensive.
You know, that is a great point, and I think really the challenge is finding the degree of growth that ensures that these are great jobs and that nurses can take care of their families and afford to live where they are working. At the same time, because registered nurses are the largest occupation in healthcare, even what seem like small changes in registered nursing pay do reverberate throughout the healthcare system. So, you know, I think that there are many, many other factors involved in healthcare costs, but we do know that when nursing wages start rising rapidly, employers start talking about scrimping on nursing. And nurses bring so many clinical skills and have such a big role in caring for people that I think it's really important to try to have what you might describe as sustainable growth in the wages of nurses so that they are able to meet their families' needs, they're able to live in the places where they work, but that you don't have employers saying, my gosh, nurse wages are growing so fast, maybe I need to come up with a way to scrimp on that, because that isn't good for nurses or patients. And so it's a nuanced question and a nuanced problem. I think the patient care ramifications of having severe shortages really swamp everything else.
What about Obamacare repeal? Do you know if this will negatively affect demand for nurses?
Oh boy, well, how many hours do you have? The analyses that I know that we have done have indicated that yes, repeal of the Affordable Care Act, because of the number of people who would lose health insurance and thus not be seeking care services, would definitely reduce the demand for workers. Now, at this point, it seems unlikely that the Affordable Care Act would be repealed without some kind of a replacement, and so the question becomes, what is the replacement? The American Health Care Act, the proposed replacement that was rejected last month or earlier this month, that would have resulted in significant increases in the number of uninsured and increases in the number of healthcare workers losing jobs. But there are other replacement proposals or modification proposals that have been put out there that may not affect the labor market negatively at all. We also know that the value-based purchasing programs that have increased the roles of nurses in ambulatory care and care management, those programs are likely to persist no matter what. Many of those programs were accelerated through legislation that's commonly called MACRA, and that was bipartisan legislation, and unless Congress went back and repealed that bipartisan legislation, value-based purchasing is likely to continue. And that also has been a facilitator of expanded and enhanced roles for registered nurses. Teri, would you like to add anything to this? I know that you're deep in the industry that is likely to be impacted.
Right. We did a study of the repeal and you know, of the repeal of Obamacare, and the impact that that would have, just in looking at Los Angeles County, I believe amounted to somewhere about 63,000 jobs being impacted. Most in healthcare, but we had other professions and occupations that were also impacted by that. There's just a lot of unknown out there. We are hearing that there will be something introduced within the next few days, possibly by next week. But for the hospitals, it's basically, you know, they're waiting to hear more. But the potential impact of the repeal could be is substantial for sure.
There are quite a few more questions, but it is already 1:06. Shall I continue reading them to you?
You know, I think what we'll do for everybody is I will go through the questions with Lena. We will try to archive them. I'm assuming that there's some way that we can get this webinar system to save them for us. And we will try to put together, you know, kind of a question and answer document online for some of the questions that seem to be commonly brought up, and they can be answered relatively easily. And we also will try to find links for some resources. There have been a couple of studies, for example, including what Teri mentioned, on the job impact of Affordable Care Act repeal. UC Berkeley's Labor Center published a report on that subject, and the Commonwealth Fund also supported a study that was done at George Washington University, for example. So we can try to put some resources out there on our website for everybody as well. Thank you, everybody, for joining us today and for indulging us in going a little bit over time. We hope that you have a good rest of your day, and also please do feel free to email me directly. My email address is easy to find, joanne.spetz@ucsf.edu. I'm happy to connect you with Teri and Judy if you don't have their email addresses, and communicate with you, because as I said, you know, this work is really comes from the input of CNOs and healthcare leaders and registered nurses across the state. So we want to hear from you about your experiences, and also to hear about what's happening across the country, because we are hearing anecdotally that these are very similar experiences across many other parts of the nation. And so to the extent that we can all share with each other solutions, that would be a great thing. So have a good rest of your day, everybody. Thank you very much.
Okay.